My name is Patrick Pathapillo. I am a PGY2 second-year internal medicine resident.
My name is Jessica Jacob. I am currently an internal medicine PGY3 resident.
I felt that if I do my residency in Phoenix, Arizona, in Creighton, in Valleywise Health Medical Center and St. Joseph's, I feel that I would have a wide diversity patient population, and that will help me reach my full potential to be the best doctor that I can be. And till this moment, I feel that I made the right choice of choosing Valleywise Health.
I knew I wanted to be in medicine actually very early, probably in high school, I want to say. But then I wanted to try everything else under the sun to make sure that's truly what I wanted to do, because I am the first college graduate of my family. And so sure enough, I found myself loving only medicine, and that's what brought me here.
So a resident is somebody who's graduated from medical school, so they're a medical doctor, they have an MD degree, and now they're specializing in an area of medicine.
Residency is truly an eye-opening and transition experience. As you are a resident, you are now in the trenches. You are learning day to day, every patient encounter, taking that knowledge that you learned in school, those skills that you've learned in school, and applying it to the patient that's in front of you. And it is a huge learning curve.
Valleywise was looking for an academic partner. They felt like Creighton was a good fit because I think of the mission. Valleywise has always been in the business of caring for those in need, right? That's who they are. And at Creighton, it's who we are too. It is our mission to care for those in need.
So we have created the Creighton University Arizona Health Education Alliance. And this allowed us to partner between different healthcare organizations, Valleywise Health, our physician partners at District Medical Group, Creighton University, and then St. Joseph Hospital and Medical Center as part of Dignity Health to really create robust training programs here within the state of Arizona.
Valleywise has been doing academics for decades. They know how to do it very well, but they do need an academic partner, a university to sort of sponsor their programs. What a wonderful thing to walk into the Phoenix area as Creighton School of Medicine and have Valleywise as one of our clinical partners who has all this experience and can provide clinical rotations for our students.
I really like being a Creighton resident because you get both hospital systems. And so you learn two different EMRs, it's just very different, the two perspectives, and it's really nice for training.
It starts with admissions, right? I mean, admissions is focused on exactly that, on finding people who have that mission feel about them that so well align with a Valleywise Health, with Creighton University, not just School of Medicine, but the whole university. I think both sides are important. Finding the right population of students and residents that are mission driven, and then really building that culture in them when they're here.
I went to medical school at Creighton University in Omaha, Nebraska. Part of what drew me to Valleywise Health was the mission of this organization. We are truly here to serve the underserved patients within Maricopa County, the patients that we're able to take care of to make sure that we have equitable access to healthcare for all that need healthcare services.
The kind of patients that you see here, they have very complex issues. At the same time, a lot of the patients that are coming here have financial constraints as well. So we also have to understand the social kind of aspects or the social situation that the patient is coming from, and we have to work through it in order to make sure that the patient gets the care that he or she requires.
I find myself that I can really relate to it. I actually put myself through college. Like I said, I'm the first college graduate, and so I worked 3 jobs, all of college, and so there were often times where I found myself debating between paying for electricity or eating. And so I can very much relate to them, and I think that helps me care for them a little bit more.
Diversity doesn't happen by accident, it's intentional. We want to have a diverse population of residents, of students that reflect the population we serve. We want that. And so I think we've been very intentional about that. We've been fortunate that our Valleywise Health leadership and Dignity Health have come together and offering scholarships for these kinds of students and residents to come here. And so I think that helps a lot to have that kind of support from your clinical partners who are already offering wonderful clinical rotations, but to also put some money in the pot to help promote some diversity in our community.
We're very transparent. Our mission within the Creighton University Arizona Health Education Alliance, we again want to make sure that we're able to serve anyone that needs healthcare at their time of need, which often is the marginalized patients of our populations. And we want people that are here to be able to make those connections, that have a desire to make those connections, that want to connect and help people in their own healthcare journey and help them get better.
I really love what we're doing. I really do.
I think 100% that this program is super supportive, and that's something that I really enjoy in this program. And if I had an option to go back in time and choose another residency program, I would still choose this program as my #1 option.
Honestly, I love every bit of it. Like, I come into work and people ask me how I'm doing, and I'm just like, I'm living the dream. This was the dream, I'm here.
To be a member of the Creighton University Arizona Health Education Alliance, to be a member of the Creighton University community, gives people a tremendous opportunity to have a vast and broad experience across all that medicine has to offer.